Why understanding neurodivergence matters? Well, it matters because the challenges that neurodivergent people face can start way before they arrive at your treatment room. They may struggle getting to the appointment, booking the appointment. They may be completely overwhelmed when they arrive at your door. They may struggle in the appointment with sensory processing, with understanding and processing things that you might have said. They might not be able to explain symptoms that they've been experiencing, and they might not be able to explain to you if they are in pain, for example, during the appointment. And when they leave the appointment, they might really overthink what's happened in that appointment and be overwhelmed with their processing of that appointment. The world is already so challenging if you're neurodivergent that it's really important that we get it right in our treatment rooms just to make it more accessible. Let's take the tiny example of how we might talk about pain in our treatment rooms with our neurodivergent clients. So something we might commonly say is this pain too much? Tell me if it's too much. Well, for some neurodivergent people, this is very tricky for them to process because too much doesn't have any parameters. There's nothing to judge the too much on. Do I have to experience the pain? How much is too much pain? Am I allowed to say if it's hurting? That is something that some neurodivergent people will not be able to cope with, and for many reasons which we're going to talk about. Some neurodivergent people have interoception challenges. They are unable to tell you what's going on inside their body. They might not be able to tell you when they're hungry, when they're thirsty, or when they are in pain. So they might not be able to explain that something's hurting until long after they're completely overwhelmed by the pain. They might not be able to process the question. So by the time they have listened to the question, processed it, understood whether they are in pain or not, they are so overwhelmed because they are in pain, or they are worried about how slow their response has been and the moment has actually passed. I could talk about masking forever, but in this situation, your client might be masking. They might tell you everything's fine when actually it's just not. And do we as therapists actually know what shutdown or overwhelm looks like in our treatment rooms? Many neurodivergent people will be worrying if they are going to get it wrong. And so they will be worrying if they're going to offend you or annoy you if they tell you they are in pain. We've already talked about the literal thinking. There is not enough context in this scenario of too much for them to be able to give you an answer. And there might be some low-level demand pressure of monitoring their own treatment that they just are really struggling with. So just by dissecting this tiny question that we might use in our treatment rooms, we can start to understand how complex it might be for somebody who's neurodivergent to be in our treatment rooms. So if you want to find out more, then this course is for you. Because I believe that if we know more about neurodivergent bodies, then we can be more curious and we can validate the lived experience of neurodivergence and make our treatment rooms more supportive. Neurodivergence affects the whole body and nervous system. Let's talk about that.